Welcome to The Verdict. Kent Meyers and Mick Cornett welcoming you back after the Christmas holidays, if any, to our show for this week. We are going to do a show on, not surprisingly, COVID in Oklahoma. We're going to bring back a guest that's been on before, Dr. Dale Bratzler from the OU Med. Mick, first of all, how was your holiday?
Oh, fantastic. Fantastic. I'm just hoping that 2021 is when we say goodbye to this dreaded disease, and instead of having it encompass our lives like it did in 2020.
Well, indeed. I don't see how Dale had any holiday at all with all that's going on in his capacity as Chief COVID Officer for OU Med. I'm sure he's just got more to say grace over. But he's an awfully good guest, and I'm looking forward to hearing from him.
Well, and we're grateful for his work and the other staff and first responders who are dealing with this 24/7.
Yeah. Well, that's our show coming up here after the break. This is Kent Meyers and Mick Cornett. You're watching The Verdict.
During my time as Assistant Secretary of the U.S. Department of the Interior, I witnessed a fundamental transformation in the government-to-government relationship between tribes and the United States. It has really been a special time when a lot of past disputes have been addressed. What I hope is that history has turned a corner with Indian tribes. My name's Kevin Washburn, and I'm a professor of law at the University of New Mexico School of Law, and I'm a Chickasaw. I always joke that I don't know why anybody's a tax lawyer, but I know why I'm an Indian law lawyer. The joy of my life is teaching students. It really is a lot of fun teaching young people, sending them out in the world to help take care of their communities. And that's what we try to do. And federal Indian law is a powerful force for that because the law often is on the tribe's side. My Chickasaw lineage comes from my mother's side of the family. She was a very strong, powerful woman. I know she had some rough times, but there's such a tremendous sense of pride now because we have really come a long way since those times. The Chickasaw Nation has always been about helping people to help themselves and help ensure that the community remains strong. And today, it's Chickasaws taking care of Chickasaws. I don't look like a Native American necessarily, but I am a full citizen of the Chickasaw Nation, and I'm very proud of that. The unconquered and unconquerable Chickasaw Nation is part of my bloodstream.
See more stories about the Chickasaw people at profilesofA.nation.com.
One of the best kept secrets about the post 9/11 GI Bill benefit is that it can be used at a trade school or a technical school, and it doesn't have to be used at a university or college. These are benefits that the veterans have earned through their service, and they should take advantage of it.
Veterans really need to understand that there are many resources offered by the Oklahoma Department of Veteran Affairs. They are there to help you find the right school for you, the school that will help you and your family make great steps into your future.
Welcome back to The Verdict. Kent Meyers and Mick Cornett with our guest, Dr. Dale Bratzler, the Chief COVID Officer for OU Med. Dr. Bratzler is making his second appearance here on The Verdict, and we greatly appreciate his time. I know his schedule is just frantic in this time period. Dr. Bratzler, just a little bit of background about him. We could take the whole show if we did justice to his vast credentials, but I'll try to synopsize it a little bit. He is board certified in internal medicine. Insofar as national recognition is concerned, he was the national organization two-term president of the American Health Quality Association. He's given over 600 lectures on health quality. in the United States. And he is just busy as a one-armed paper hanger dealing with our COVID crisis here in Oklahoma. Dr. Bratzler, really glad to have you back.
Thank you for having me.
Dr. Bratzler, give us an update. Now, we're taping this show a few days before it actually airs, so assuming things go as planned, how would you say we have done in this period where we've been waiting for the anecdote to come forward? It just seems like the numbers have been rising here with the cold weather, like a lot of people predicted.
Yeah, so I highlighted the other day in a press briefing that during the month of November, when we saw just such explosive growth of cases in Oklahoma, we actually confirmed 37% of all of the cases of COVID-19 in the state that we've seen since the start of the pandemic, just in 1 month. And so we've had this very, very substantial rise in the number of positive cases and have been seeing 3,000 or so new cases almost every single day that have been confirmed in Oklahoma. And I think everybody's aware that we've been seeing increasing numbers of people who have succumbed to the disease, which is very tragic. You know, the only good news kind of currently is that we've seen a bit of flattening of the curve, but everybody is still worried about what happens with all of the holidays. Will we continue to see a rise in cases until we're able to broadly vaccinate the population?
And
let me ask you, I'm sorry, go ahead, Mick.
I'm going to say that vaccine is upon us.
It is upon us. So first doses should have arrived in Oklahoma by December 16th and will start being distributed. Not a large amount. I think 30,000 doses or so will come with the first shipments that come to Oklahoma. It'll be the Pfizer vaccine that many people have heard about. And by now we will have been starting to get all of the frontline healthcare workers that directly take care of COVID-19 patients vaccinated, and also our nursing home population in the state.
Let me take a step back from the vaccine discussion and go back to the rise in cases in Oklahoma. Can you give our audience a summary of where are the hot spots? Well, I suppose the whole state practically is a hot spot, but break it down between rural and urban. How would you do that?
Yeah, so every single day I look at the number of cases that are reported by county in Oklahoma. And of course, Oklahoma County, Tulsa County, Cleveland County, which are the most populous counties in the state, they always have the highest case numbers on a daily basis. However, if you look at the number of new cases by population incidence, in other words, what proportion of the population of a county is being confirmed with a new case of the disease, this has actually become very much a rural disease in Oklahoma. There are many rural counties that have faster spread of the virus right now than any of our urban counties. So I'll use as an example Alfalfa County, which has seen a large increase in the number of cases. And sure, it's a small county. It doesn't have a huge population, but when you look at the time that we're recording, they'd only had 571 cases since the start of the pandemic, but 176 of those in the past week. So they're seeing very rapid growth of the number of new cases, and that's true in many rural counties in Oklahoma. It's really become very much a rural disease. The other point I'll make is that I track, again, all the counties every day, and we've seen that western Oklahoma, perhaps because it's been colder, snowstorms, things like that happen typically this time of year, have had higher cases than eastern Oklahoma. We'll see if that trend continues.
And how about the severity of what we're experiencing? Are medical clinicians doing a more successful job of dealing with the patients that come in?
So let me take that in two different ways. First, when we look at any newly confirmed case, we know that about 10% of the people who are diagnosed with COVID-19 will end up in a hospital bed. And that's why we're seeing our hospitals struggle with a large number of cases, just because of, when you see 2,000 to 3,000 new cases every day, you're going to have a lot of people that end up in the hospital, even when it's only 10% of those that have the disease. So that's what drives a lot of the hospitalizations. There are a couple of things, though, that are happening now. Obviously, vaccination for our frontline healthcare workers will at least make sure and hopefully keep our frontline healthcare workers in place. And by vaccinating our nursing homes, will reduce the number of those patients that come in. But we actually have a couple of drugs right now that seem to be very, very promising in terms of reducing the severity of the disease. So I want to highlight monoclonal antibodies. These artificially made antibodies against COVID-19 that you give to a patient before they're sick enough to be in the hospital. These actually appear to be pretty effective. You can't predict when you see a patient that's newly diagnosed with COVID-19 whether they'll end up in the hospital or not. So you end up giving the monoclonal antibodies to some people that probably would have done okay anyway. But these drugs, if given early, stop the virus from replicating and can really slow down the course of the illness and keep the patients healthier. So that's what we do early, and trying to keep people out of the hospital, particularly for people who are older, high risk, have complications that we know predict hospitalization. And then the second thing is when a patient gets into the hospital, particularly really sick on oxygen and other things, we know the old drugs, the corticosteroids that we've had around forever, are very effective at reducing mortality, about a 25% reduction in mortality from COVID-19 in severely ill patients. So the good news is the treatment has gotten better over time, and that's in addition to all of just the routine supportive care that we give patients when they're sick enough to be hospitalized.
Doctor, just in about a minute, because we've got to go to a break in about a minute. When should a person go to the hospital?
Well, we certainly, anybody who's having symptoms, particularly trouble breathing, is when we often see patients that need to be hospitalized. So if you're having difficulty with breathing, that's the time that you often go to the hospital. We will admit patients fairly routinely if their blood oxygen levels are low. So that requires a test called a pulse oximetry, but that's how the decision is often made. There are other complications of COVID-19 that may result in hospitalization, like stroke, heart attack, and other things. Of course, most people with those will show up at the hospital without any questions.
Well, thank you very much. And this brings us to the first break. Folks, you're watching Dr. Dale Bratzler, the Chief COVID Officer at the University of Oklahoma Med. And Mick and I will be right back with Dr. Bratzler.
OU Law has a history and heritage that are unparalleled. At the University of Oklahoma College of Law, we empower our students to pursue the career of their dreams. We have the highest U.S. News ranking ever achieved by an Oklahoma law school. We are the first law school in the country to launch a college-wide digital initiative. And this year, our competition teams rank #2 in the nation. OU Law, generations of excellence, limitless possibilities.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
Welcome back to The Verdict. Kent Meyers and Mick Cornett with Dr. Dale Bratzler, our guest. Dr. Bratzler is the Chief COVID Officer at OU Med. The doctor, when we finished, we were talking about when one should seek hospitalization or seek medical care because the symptoms of COVID are similar to those of other diseases or problems. You mentioned off the air that getting testing done is a good thing to do to determine whether or not you ought to head to the hospital.
Yeah, so we actually strongly recommend that people who've developed respiratory symptoms this time of year, flu or COVID, you can't tell the difference just based on symptoms, to actually not go into the hospital or to your doctor's office, but call and talk to your primary care physician to make that decision. The second thing is, if you have any concern at all, I strongly recommend that you get a test done. Tests are freely available in Oklahoma. You can call 211 at the Oklahoma State Health Department. You can call your county health department. Many health systems have testing available. You can go to urgent care centers, but get a test. It's the only way to know for sure whether or not you have COVID-19 or not. And now we have tests available that will test you for both COVID-19 and influenza at the same time with a single specimen. And so the good news is that you can be tested for both, because this is respiratory virus season of the year, and you can't tell the difference between just based on symptoms.
Are the shots very similar when they're given? And I've heard reports that you may have more than one shot. So fill us in on the actual process.
Oh, so for vaccination, yes. So the first product in Oklahoma is the Pfizer vaccine that many of you have heard about, and appears to be very effective and quite safe. It's the vaccine that has to be kept in ultra cold storage. Storage. So we're talking about minus 100 degrees. And so there are only a limited number of places around the state that have that infrastructure to actually deliver that vaccine. That vaccine is given as a first shot, and the FDA reported that about 50% of the people will have good immunity within 10 days of the first shot, and then you get a second shot 21 days later. And it's after that second shot, within a week or so after the second shot, the studies show that it's about 90 to 95% effective. The second vaccine that we will be seeing here in Oklahoma right around the time we're airing the show will be the Moderna vaccine, which is another vaccine that doesn't require quite the ultra cold storage. So it'll be a bit easier to distribute around the state to different settings so that we can get more Oklahomans vaccinated.
Will that shot also require a second immunization?
Yes, the Moderna vaccine also requires a second dose of the vaccine 3 to 4 weeks after the first dose. So that's going to be very important. And when you actually get your vaccine, your data is entered to the state health department. They will actually contact you at the appropriate interval to remind you to get the second dose, because you really need the second dose to really boost your immune system.
How will the professionals determine whether or not I might get a Moderna shot or a Pfizer shot? Are they interchangeable in that sense, except for the storage requirements?
Yeah, so that's a really great question, Kent. So if you get the Pfizer vaccine for the first dose, then 3 weeks later you need to get the second dose with the Pfizer vaccine. That's going to be the safest thing to do. I think a lot of what you get is going to depend on what's available in your area. So again, the Pfizer vaccine requires that minus 100 degree storage, and so there are going to be limited places that actually can just easily deliver that particular vaccine. The Moderna vaccine needs to be kept refrigerated, but not at such a cold temperature. And so I think when we get further into the vaccination process, the Moderna vaccine will likely be available in smaller communities and physician offices down the road that can keep it cold, but don't have the capability to keep it 100 below zero.
What are your concerns at this point? What can go wrong? What should Oklahomans message each other if they're talking to their kids or talking to their neighbors? What should they remind people to do?
So I've been really clear about this recently, that I think all of us want to go back to what we remember as the old normal, that our schools are open, that our places of business, our restaurants and places that we worship, where you can go back to the activities. The only way we're going to get there in the short term is through vaccine, but we know we're not going to have enough vaccine in Oklahoma to really get a large enough proportion of Oklahomans vaccinated to get back to that old normal, probably before the summer. So we can't let our guard down between now and then. So I've been really asking Oklahomans, please step up during this time frame. We can get there, but until then, you need to wear your mask. You need to try to, socially distance yourself from others. Continue to do good hand hygiene. Remember the public health interventions, because just because we're vaccinating people doesn't mean this pandemic is over yet. And so that's very, very important. One more really important point to make about the vaccine. When you look at the studies that have been published, that they actually have looked at the safety and effectiveness of these vaccines, we know they prevent severe disease. In other words, when you get vaccinated, you're less likely to have symptomatic COVID-19. What we don't know yet is whether or not when you get vaccinated that you don't get infected. In other words, could you get vaccinated, still get the infection and just have no symptoms? In other words, feel fine, but even potentially spread the virus to somebody else. We don't know that yet. So that's why we're going to be strongly encouraging people, just because you get a vaccine, you can't let your guard down. You need to keep wearing a mask to protect the people around you until we know exactly how these vaccines prevent disease.
What's your, I realize it's more than just a guess, but what's your educated guess about how long it will take to get all of the population of Oklahoma that wants to get vaccinated?
Yeah, so the state health department, with a group of experts, have developed a 4-phase plan for vaccinating Oklahomans. And quite honestly, a bit of it's going to depend on how many doses actually get shipped to Oklahoma and can we get them out there effectively, because we know that the initial shipments aren't going to even come close to covering the population. But by phase 4, when the vaccine is generally available to the general public, I think it'll be maybe late spring, but more likely the summertime, before we actually see enough doses out in the community that people can get the vaccine if they want to get it, to where we can get to this concept of herd immunity, which would mean that somewhere around 70% of Oklahomans have some immunity to the virus that causes COVID-19.
Mm-hmm. And what's your best guess as far as down the line? I mean, there's a different flu shot almost every year. Will we be immunizing ourselves against COVID in subsequent years?
Well, it's a really good question. So I've talked to a number of vaccine researchers at the NIH and others, and right now, even though there are mutations of the virus that cause COVID-19, they haven't seen major mutations that would require annual vaccination with a COVID vaccine. That said, it is possible down the road that the virus may mutate and that we may have another outbreak with a different strain that might require a different vaccine. And the other thing we won't know for some time is how long immunity lasts after you get the vaccine. There's pretty good evidence that it's very good. The vaccines are very good at causing you to develop immunity. And we think that it will probably last for some sustained period of time. But how long that is, we just don't know, because remember that we're only going to have several months worth of efficacy data on these vaccines to know if they're going to give you really long-term protection.
That's going to have to be our last word, because we've just run out of time. Dr. Bratzler, thank you so much for giving us time today. I know how busy you are, and Mick and I really do appreciate it. We are going to take a little 2-minute commercial break, and then Mick and I will be back with you to close the show. You're watching The Verdict. We'll be right back.
It used to be okay in teachers' lounges. It used to be okay in maternity wards. It was okay in sporting arenas, college campuses, and office spaces. But now that we understand the deadly dangers of secondhand smoke, that's not okay anymore. So why is it okay that thousands of employees are exposed to it every day at work? Bottom line, it's not okay. Let's protect hardworking Oklahomans. Join the fight at stopswithme.com.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
You will always be mom and dad to me.
I think for us, once we got started and we began to see the tremendous need just within our state, it really was just a calling for us. The blessings far outweigh any obstacles that we've faced.
You will always be mom and dad to me.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Welcome back to The Verdict. Kent Meyers with Mick Cornett, closing up this show with Dr. Dale Bratzler, the Chief COVID Officer at OU Med. I thought Dr. Bratzler gave us a bunch of good information. Some of it we've heard before just from others, but he really is able to put it in a positive, understandable way for all of us.
Website information for Dr. Bratzler, oumedicine.com. And we have a website, theverdict.tv.
Well, thank you very much for joining us today. Hope you had a grand holiday. Stay safe. From Mick Cornett and Kent Myers, we'll see you next week.